Okay, so in this video we're going to do intramuscular injection Z-Track method, reconstitution medication. So we need to go over the 6 rights. So right patient, dose, route, drug, documentation, and time. And then we'll check the order. So it's Brosifin 1 gram intramuscular every 12 hours for 6 days. We've got to reconstitute using the Z-Track method. Okay, so we have to look on the powder that we have to put liquid into, and it's 1 gram, so I'm gonna go for the 500 milligram to liters. So we need to add 5.6 milliliters, and then it would be in total 6 milliliters. Yeah. Okay. Okay, so we're gonna pop the tab open. Okay. And then we're gonna clean off the top. Of the solution, and then of the powder. Okay. So we're gonna take our syringe needle. So it's 5.6. So this one only goes up to 3. This is the biggest size I got. Okay. So we're just gonna pull all the way down to 3. And go into the solution. Put your air. And then we're gonna pull back until we get 3 milliliters. And then we're gonna go into the powder. And then we're just gonna check. So this becomes okay. And then we're gonna pull back. So now that was 3, so now we only have 2 and a 6. So we will inject that air and pull all the way back until we get 2 milliliters and a 1/6. And then we'll go back into the solution. And you kind of want to get all that powder mixed. Okay. And then we want to throw this syringe into the sharps. Okay. Now we want to rotate make sure it's all mixed. Okay, we don't want to shake it, we just want to slowly mix it together. Okay, so I have a new needle, but you could have used that same syringe and just changed the cap into the correct size that you need for the route and the medication. So we will just use a new needle. Okay, so now we'll clean off the top again of now this reconstitution. Okay, so now we need to know how much our patient will need. So he's getting 1 gram and then so we're gonna have to do some math, so we need to know how much he will be getting. So we will be doing, so he will be getting like 12 milliliters. Okay, but we're just gonna, for the sake of this video and the type that we have, we're just going to give 3, okay? But you would just have to do medication for it. The math for the medication. Okay. So we wiped off this. So now we will ask the patient for 2 identifiers. So name and date of birth, and his name is Skip Rocker, and his birthday is January 1st, 1972. Then we'll explain the procedure that he's getting a Z-Track IM injection, and we could do it in the ventrogluteal, so in the butt area, or the vastus lateralis, which is on the side of the butt. So for the first one, the patient would be either laying on their side or standing. And then for the second one, the patient will be either supine or sitting. Okay. So we will need to draw up how much medication. So it'd be kind of a lot. So we're just gonna do 1 so it doesn't spray everywhere. So and then okay. And then recap the needle using the one-handed method. Perfect. And then we'll wash our hands and put on gloves. Okay, so then now we will allow to clean the site in circular motions. So you would make like a triangle if it's like the iliac crest, and yeah. Okay, so we will, so you'll have to pull skin away. Okay, so you have to pull. So we'll uncap the needle. So you pull, and then you go in a 90-degree angle. And then gotta hold onto, with your non-dominant hand, you have to hold onto the syringe and aspirate until you, if you see blood, and you don't, so then you're good. So then inject slowly. Until you, okay, got all the medication. And you want to hold in there for 5 to 10 seconds, and then you will pull out fast and move the skin. So it all just stays in the one spot. And then we'll dispose of the needle. Okay. And then document the injection site where we did it, and what type of medication, how the how the patient responded to the medication and the procedure, and just check up on him to see if he's having any pain still.